Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Okay, so today we're diving into the world of TNF antagonists. And we've got this really informative piece from Alberta Rheumatology to help us break it all down.
It's a fascinating area of medicine, and it plays a big role in how we manage inflammatory arthritis these days.
Yeah, and for our listeners who are really trying to stay informed about their treatment options for inflammatory arthritis, this is key information, right?
Absolutely. Knowledge is power when it comes to making healthcare decisions.
For sure. So let's start with the basics. What exactly are TNF antagonists?
The name sounds kind of intimidating, like something out of a science fiction movie.
It does sound a little intense, right? But it all comes down to what TNF actually stands for, tumor necrosis factor.
Tumor necrosis factor. Okay, so maybe not something you want to run into in a dark alley.
Right. But it's actually a naturally occurring molecule in our bodies, believe it or not.
Real. So it's not some kind of like foreign invader.
Nope, part of our own system. TNF is part of our immune system, and it actually does a lot of good stuff, like helping our bodies fight off infections. So it's one of the good guys, usually.
Exactly. It helps keep our immune system in check, but sometimes in certain conditions, like inflammatory arthritis, TNF can kind of go into overdrive.
So it's like TNF means well, but it gets a little carried away sometimes.
That's a great way to put it. And when that happens, when TNF goes unchecked, you get inflammation, and that leads to pain, stiffness, all the things people with inflammatory arthritis know all too well.
Okay, so that's where our TNF antagonists come in, right? They're like the ones who step in and say, all right, TNF, let's chill out a bit.
Exactly. They're like the bouncers at the TNF party, making sure things don't get too out of hand. They essentially block the effects of TNF, preventing it from causing so much inflammation. Technically, they are biologics, a newer type of DMARD, which stands for disease-modifying anti-rheumatic drug.
DMARD, I always feel like I'm going to trip over that acronym.
It is a mouthful, but the important thing to remember is that they're different from your typical pain relievers. We're not just masking the symptoms here, we're actually targeting the underlying inflammation that's causing all the trouble.
So it's like, instead of just turning down the music at the party, TNF antagonists are asking TNF to maybe switch to a different playlist.
I like that analogy. And the really cool thing is that the Alberta Rheumatology website, which we're using as our guide today, actually lists out all the different types of TNF antagonists and even their typical dosages.
That's really helpful because I'm guessing the dosage isn't one size fits all, right?
It varies from person to person depending on a whole bunch of factors. A doctor would consider things like the specific type of inflammatory arthritis, how severe it is, the patient's overall health, and so on.
So it's about finding that sweet spot, the right dosage for each individual.
Exactly, like finding the right pair of shoes, got to get a good fit.
Okay, so we've got these TNF antagonists. They're like the peacekeepers for our immune system. But the big question is, do they actually work? Like, do they really make a difference for people with inflammatory arthritis?
It's a good question, right? Because we're talking about some pretty powerful medications here. But yeah, the research is actually really promising. Studies have shown that TNF antagonists can be really effective in treating various types of inflammatory arthritis.
So it's not just about masking symptoms. It's actually about, like, improving people's quality of life.
Exactly. And not just day to day, but long term as well.
That's amazing. So we're talking about reducing pain, stiffness, all that, but also potentially slowing down the progression of the disease itself.
You got it. And that's huge because we want to help people stay as mobile and active as possible for as long as possible.
Absolutely. So it's not just about feeling better. It's about protecting those joints for the long haul.
Exactly.
Now, of course, with any medication, there are always potential side effects, right? And I know the Alberta Rheumatology piece that we're looking at today gets into that as well.
Yeah, and I appreciate that they don't shy away from that because it's important for people to be aware of both the benefits and the potential risks.
Absolutely. Informed decisions are the best decisions, right? So let's talk about those side effects for a bit. What are some of the things that people should be aware of?
So some of the things that come up are an increased risk of infection, especially lung infections.
Okay, that's definitely something to keep in mind.
Yeah, and there's also a slight increase in the risk of certain cancers.
Okay, so those are all things you'd want to talk to your doctor about. Weigh the pros and cons.
Definitely. And I think the key here is that these are potential side effects. Not everyone experiences them. And there are ways to manage and mitigate these risks.
That makes sense.
It's all about having those open and honest conversations with your doctor. They'll take into account your medical history, any other medications you're on, and come up with a plan that feels right for you.
Right, because it's not a one-size-fits-all situation. Everyone's different.
Exactly.
Now, speaking of other medications, What if someone is already on something like methotrexate for their inflammatory arthritis? Do they have to stop taking that if they start a TNF antagonist?
That's a really common question, and actually the Alberta Rheumatology information addresses that directly. Often they actually recommend continuing methotrexate even when starting a TNF antagonist.
Oh, interesting. So it's like a two-pronged approach.
Exactly, you're kind of attacking that inflammation from different angles.
Okay, so it's kind of like a tag team effort.
Exactly.
I like it. So it seems like that open communication with your doctor is key throughout this whole process.
Absolutely, 100%. And being upfront and honest about all medications, supplements, everything you're taking, that's important for your doctor to know.
Absolutely. Now, let's get into some of the more practical aspects of TNF antagonists.
Yeah.
Like, let's say you forget to take your dose one day. Does that mean you're, like, back to square one?
Well, the good news is that an occasional missed dose is generally not a major cause for alarm. Typically, you can just take it as soon as you remember and then get back on schedule.
Okay, so a little bit of forgiveness built into the system. That's good to know. What about if someone is thinking about stopping their TNF antagonist altogether? Like maybe they've been on it for a while, they're feeling good, and they're wondering if they really need to stay on it long term.
Yeah, that's definitely a conversation to have with your doctor, and the information from Alberta Rheumatology makes it clear that stopping is generally considered safe, but it's not like flipping a switch. The effects of the medication will gradually wear off over a few weeks.
So no sudden withdrawal symptoms or anything like that.
Right.
But definitely don't go rogue and make changes to your medication on your own. Always involve your doctor in those decisions.
Exactly. They can help you weigh the benefits and risks, make sure it's the right choice for you.
Right. It's always best to have your doctor in the loop, make sure you're both on the same page.
Exactly. They can guide you, help you make the best decision for your situation.
It seems like that's been a recurring theme throughout our deep dive today, that open communication with your doctor is so crucial when it comes to TNF antagonists.
It really is, because they are powerful medications and everyone responds a little differently. So having that open line of communication can make all the difference.
Absolutely. So for someone listening who might be thinking, wow, this is a lot of information, where do I even start? What would you tell them? What's that first step?
I think the first step is just knowing that these medications exist, that there are options out there for managing inflammatory arthritis.
So it's about being informed, empowering yourself with knowledge.
Exactly. And once you have that knowledge, you can have those conversations with your doctor. You can advocate for yourself.
Right. You are your own best advocate when it comes to your health.
Absolutely. And the more you understand about your condition, the treatment options, the more confident you'll feel in those conversations.
So true. Well said. Well, I feel like we've done a pretty deep dive today on TNF antagonists, but it's been fascinating.
It has. It's always interesting to explore these different treatment approaches and how they can impact people's lives.
Absolutely. And for our listeners, remember, this is just a starting point. There's a whole world of information out there. So keep asking questions, keep learning, and keep advocating for yourself.
I completely agree. Knowledge is power when it comes to your health.
Couldn't have said it better myself. And with that, we'll wrap up our deep dive for today. Thanks for joining us, everyone, and we'll catch you next time.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Eifel, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.